know who I am. I'm the dude playing the dude, disguised as another dude. Hello, listeners, and welcome back to another week's episode of the Mursenary Podcast. This is your host, Nurse Rick speaking. And today, we're going to cover something that's actually an informational topic for, I feel like, most people. If you're in the medical field, you definitely know exactly what this is. If you're not in the medical field, maybe you've heard of it, maybe you've seen signs for it around your, YMCA, where your grandma goes and works out. If you haven't seen it, well, I'm going to explain it to you. It is the B-Fast scale. And what is the B-Fast scale for? It's for stroke awareness. I feel like last week's movie quote probably would have gone better on this week's episode, but I didn't think that far ahead. Okay, so anyway, without further ado, let's talk about strokes. According to the CDC, there are about 795,000 strokes every year. 610,000 of these are the first time or new strokes. 87% of these are ischemic strokes, meaning there is a blood clot blocking blood flow in the brain, and these are highly treatable if caught early. The other type of stroke that isn't really mentioned in this is hemorrhagic stroke, meaning a bleed stroke, meaning you have a blood vessel somewhere in your brain that's popped and is leaking blood into your brain tissue, which is not good. The earlier you catch a stroke, the better, regardless whether it's a ischemic or a hemorrhagic stroke, whether it's due to not getting blood in the brain or blood bleeding into your brain. Both of those are bad, but if you catch them early, survival rate goes up generally. The earlier you catch these, the better the chances of survival without lingering disabilities. I've seen people that get strokes and don't come into the hospital and they're fully debilitated on one side. I've seen some people that have any sign of a stroke and they come into the hospital to get checked out and we catch it right away. And within a few days, they're back home, which is always the best possible outcome. So anyway, let's talk about B-Fast. This is an acronym used to assess for signs of stroke. You should know them. If you can't remember all of them, remembering just a few can save you or a loved one. Saved? Can save you or a loved one. Good Lord, I can't talk today. The acronym stands for balance, eyes, face, arms and legs. I know there's no L in there, but it's arms and legs. Please remember that. Speech and throbbing headache or time. We're going to start off with balance. If you notice in yourself or a loved one a sudden loss of balance, a staggering gait, basically someone who looks shit-faced and they haven't been drinking, that's a key sign of stroke. Next up, we're moving on to the eyes. If you notice a sudden loss of vision, blurry vision, loss of pupil reflex in one or both eyes, that's a bad sign. You're 2 for 2 on the stroke scale so far. We're moving on next to the face. If you look in the mirror and half your face looks droopy or a loved one's face looks droopy, they can't form a smile or raise their eyebrows, one of their eyelids is falling down, and the other side responds normally, that's a bad sign. Arms and legs. If you or a loved one notices sudden weakness, numbness, or both in one arm and one leg, guess what? It's a bad sign. Speech. If you or a loved one notice that you can no longer make words make sense, or your words are really slurred, or people are saying things to you and they don't sound like words of your language, I'll give you a second to guess what this is. Spoiler alert, it's a bad sign. Terrible headache. If you or a family member have a sudden, severe, earth-shattering headache that won't go away, and it's accompanied by one or many of these other symptoms, we know where this is heading now. It's a bad sign. Get your ass to the hospital. You need to get checked out. But I don't want to go to the hospital. I think I'll be fine if I just take a nap. No, don't take a nap. Go to the hospital right now. Because the other part of terrible headache, the other thing the T stands for is time. The quicker you get to the hospital, the quicker we can find it if you're having a stroke, and the quicker we can help reverse that shit. Now, we can't always 100% reverse it. If it's a bleed stroke, we might have to go in there and try to cauterize something. There's many different interventions. But the longer you're bleeding into your brain, the worse the outcome is going to be for you. The longer that your blood is not circulating in your capillaries and veins and arteries in your brain, giving it oxygen, that's a bad thing for you. It's going to result in more disability, longer recovery, more need for rehab. even maybe to the point where you can't go back home and you're going to spend the rest of your life in a nursing home. We don't want that. Go to the hospital. What you should do if you notice that you or a loved one are having any of these symptoms, immediately note what time it is. That way, you can say, these symptoms started at 3:30. That way, we know we have until 4:30 to try to get you something to break a clot up that's in your brain. It's called TPA. It's pretty cool. Call 911. Tell them what symptoms you are seeing. They are going to woo-woo over to your position and get a Limp Biscuit loaded. That's such a bad one. While waiting on the ambulance, keep yourself or loved ones safe. Monitor them for worsening symptoms. Ensure they aren't trying to walk around because a stroke and a fall breaking a hip isn't a good time for anyone. Also, you should make sure they don't lose consciousness. Try to keep them awake. Don't freak out because you'll freak them out. The calmer you stay, the calmer they will stay. If they do slip into a nap time, get them on their side if possible in the Sims position so that if they vomit while unconscious, you can clear the secretions, which I know sounds nasty, but you're going to have to stick your finger in there just like you kind of do with a baby. Try to get that stuff out, clear the airway. Clear the secretions so they have a patent airway for when EMS arrives. Well, that was a 5-minute episode, roughly. Let's move on to this week's fun fact. This fun fact for this week is going to come from mentalfloss.com. And it's going to be a wacky medical treatment from history. Something that has no business being a medical treatment in the modern world and is not anymore, thankfully. It's going to be mercury use for syphilis. For most of history, a syphilis diagnosis was incredibly grim news. And at the turn of the 20th century, most doctors' best treatment involved administering toxic mercury to the patient indefinitely, giving rise to a popular quip about lovers spending one night with Venus, a lifetime with Mercury. Even as medical knowledge improved in the early 1900s, treatments still involved dire measures like taking arsenic or deliberately inoculating the patient with malaria, which would raise the body temperature and kill the syphilis. Thankfully, these scary treatments all went out the window with the introduction of penicillin in 1943. I wonder how many people survived the mercury treatment and then went on just to become Mad Hatters, you know, where the Mad Hatter came from in the Alice in Wonderland. Basically, when you had to make old school hats, you had to use mercury in that, and that would lead to mercury poisoning, and that led to the whole Mad Hatter thing. Now you know, that's 2 facts for the day. See, you getting a 2 for 1 because I took a week off. So, anyway, that's going to do it for this week's episode of the Mursenary Podcast. I hope that you all enjoyed listening. I hope that you all learned something. I hope that you guys can share this with your friends and family. Keep an eye on Grandma and Grandpa and your mom and dad, and even potentially yourself, because one risk factor for strokes is going to be nicotine use and birth control, and there's a lot of girls I know that vape and take birth control. Is it likely they're going to have a stroke? No. Is it impossible? Also no. All right, that's going to do it for this week's episode of the Mursenary Podcast. I hope you listeners enjoyed. I will be back either next week or the week after with another episode. I'm getting ready for a travel contract. Things have been very, very hectic. Be sure to go check out the social media. Check out the YouTube, Instagram, Twitter, X. And I'll catch you all in the next one.